Good afternoon. My name is Anil K Dcruz. I'm a head and neck surgeon, a cancer surgeon. I'm currently Director of Oncology at the Apollo Hospitals. I'm also the President of the Union International for Cancer Control, which is the largest NGO committed to the cause of cancer control and based in Geneva. I've had over 33 years experience in cancer. I worked at the famous Tata Hospital and finally left as director of the hospital. And today I wish to share a few facts about cancer because the cancer disease is evolving, it's changing. In my own lifetime, I've seen so many changes, and I thought I would share some of those facts with you, which would be beneficial for the lay public. We must realize that the incidence of cancer is increasing. About a decade or two back, we hardly knew about cancer, but now we are seeing an increasing number of cancer cases in our country. And this primarily happens because cancer is a lifestyle disease. As you age and your lifestyle changes, there's a higher incidence of cancer. So in the West, in the developing countries, cancer is very, very common. And slowly we are seeing those numbers in our country as well. It's important for us to understand that we should not get scared, not get frightened when you hear the word cancer. Two-thirds of cancer are because of our lifestyle. And the most important part in our lifestyle are our habits, tobacco and alcohol. 18% of cancers globally are lung cancers. 10% of deaths are lung cancers. And that's because people are smoking. In our country, oral cancers, head and neck, of which I'm a specialist, is the commonest cancer. About 30%, 25 to 30% of all our cancers in our country are head and neck. What are these cancers? These are cancers, as the name suggests, in the head and neck region, mouth, the throat, the tonsils, the voice box, the upper part of the food pipe. And that's because in our country, tobacco is a socially accepted custom. Stop tobacco, 25% of these cancers won't be there. The other two common cancers are women cancers in our country, and that's breast and cervical cancer. Now, all three cancers, head and neck cancers, breast cancers, and cervical cancers, are easily amenable to examination. You get them in stage 1, you have a 90% chance of cure. And I think the second message is, first is that cancer is prevented. It is preventable. The second is that if you have, or you're the unfortunate group to get cancer, if it's early diagnosed, 90% cure with the least functional and cosmetic problem. So how do we diagnose a cancer? It's very simple. If there's any swelling in your body, particularly ladies, if they get a breast lump, a newly diagnosed breast lump, you need to go see your doctor. For head and neck cancers, you get a patch in your mouth, particularly if you're a tobacco user, a patch that stays for a couple of weeks and doesn't go, you need to go see your doctor. If you have a lump anywhere on your body that's recent, you have a mole on your body, which is a black discoloration pigment that's growing, you need to go see your doctor. And the other important signs are bleeding from any orifice. You bleed from your nose, you have bleeding in your urine, your stools change color and there's bleeding. Ladies have abnormal bleeding which is not related to the menstrual cycle. You need to go see your doctor because these are all warning signs of cancer. Apart from that, cancer can also affect the blood or the lymph nodes, what we call leukemias and lymphomas. Generally, because these are related to what we call the hemopoietic system, your blood is slowly replaced by blood which doesn't function as what the normal components of blood should be doing. So what are these? Red blood cells, they carry oxygen. So your red blood cell count drops. You get feeling of tiredness, breathlessness. You don't feel good at the end of the day. White blood cells, the white blood cell counts increases, but they're abnormal cells. So they're not able to fight infection, which our white blood cells do. So people get fever and then they know that there's something wrong. Platelets are the third component of blood that help us to clot blood, to prevent against abnormal bleeding. Once your platelets gets abnormal, you might continue to bleed from a casual wound. You can have spontaneous bleeding, so there'll be bluish patches on your hand, on your body, and then just following trivial trauma. So your red blood cells, your white blood cells, your platelets are not functioning normally, and all you need to do is go to a doctor, do a smear, and then start treatment. Lymphoma is seen by little swellings, which are lymph nodes, commonly occurring in the neck, in the underarm, in the groin area, and these are all amenable to examination when you're bathing yourself, you're soaping yourself. So I would like to say that all of us should be aware, prevent cancer, and be aware of the warning signs of cancer so that you don't have to get scared, but just come to your doctor. Upwards of 90% cure. I want to end by saying when I was at Tata's, at 2 time points in my career, I did a study understanding as to why patients come late. Unfortunately, 60 to 80% of our countrymen present to the doctor late, and that's why outcomes in our country aren't as good as the West. We have great hospitals, we have great infrastructure, we have great manpower. Despite all this, if you come late, control rates, success of treatment is much less. So choose your hospital correctly. You need to go to hospitals that specialize in cancer, what we call oncology departments. You need to go to hospitals that specialize and give you a multidisciplinary care. That means they have surgeons, they have radiation oncologists, they have a medical oncology department, they have support staff of good radiology as well as pathology. And you need to go to hospitals that offer you niche area practice. Gone are the days of community practice in oncology. Now it is advanced so much that we need people to be specializing in one particular part of the body to give the patients the best outcomes, both in terms of function and cosmesis and the highest survival rate in cancer care. So these are my few messages for you all today. Cancer is preventable. Cancer is treatable if early detected. And please choose wisely whenever you have a diagnosis in your choice of place where you would want your cancer care. Thank you.